the Council has initiated the establishment of the Kenya Devolution Institute and an innovation and training hub that will enhance leadership capacity, support peer learning, and institutionalize knowledge sharing across counties. Through the Kenya Devolution Institute, the Council aims to enhance professionalism, promote intergovernmental collaboration, enhance common knowledge on devolution in Kenya, and cultivate a sustained culture of innovation and peer learning across county governments. Haphazard contracts were awarded. People are posted to counties. The counties are expected to supervise them, yet they are not in control of the payroll. When they are not on ground and we want to take disciplinary action, we can't because we are not the ones who release their salaries. We write letters to MOH. MOH will tell us, and it should be directed to Public Service Commission. The deal that's on the table with respect to UHC doesn't solve the problem that we are having at hand with respect to the UHC workers. And the problem is, who takes care of the gratuity after they've worked for the 6 years? The problem is, if we are to absorb them in perpetuity, as my Chair of Health has said, has that been factored into the budgets going forward? It has not been. And that's why we're saying, because this is a contract that is now with the national government, let them end it in a seamless manner and then give every county funds to absorb those UHC staff as permanent, as per their needs. And counties will only absorb staff on permanent or contractual basis going forward on the basis that the money they have and their needs. That's all. We didn't say we're not working with the ministry, right? But we cannot sweep problems under the carpet. We can't manage the country through optics. We have to deal with the problems and face them as they are. And health is one such thing that cannot be managed through managing optics, because we are the ones who are managing the real health issues on the ground. And what we're actually seeing here is the CS is trying to transfer his problem to us. Because if the UHCs that are at work are not funded in perpetuity, the moment their contract ends, they'll start demanding that counties absorb them. And all we're saying is, where is the money to absorb them? So we will only do that if there is sufficient increase in the equitable share to employ them at the same rate that their colleagues in the counties are being offered. And as for the existing contract, if MOH has continued to have them in their payroll for the last 5 years, we don't see the urgency of transferring them to us. There's also the matter of gratuity. These people will have worked for 6 years. We're not being told who's going to pay for their gratuity, and we don't have the money as counties to pay for that gratuity. And these are the reasons why we have looked at this arrangement and have seen it's not acceptable to us. It's just transferring to us problems which we will not be able to deal with. And in the past, we have accepted certain arrangements in good faith, and Big Brother has not kept his part of the bargain. We don't want this to be one such arrangement. And that's why we're saying, cause the problem, deal with it until you ensure a seamless end to the contractual arrangement. And if you want us to take up those people, give us the money.
On the other issue, we continue to condemn this idea of quite a lot of money being left in the Ministry of Health headquarters. Some of you the other day were just invited to see us receive very many vehicles. And you wonder matters as simple as procurement that can be done in the counties is really being taken up by national government through the Ministry of Health and like so many other projects that are being mentioned. And so we want to humbly request all of us. Kenyans demanded devolution. They fought for devolution. And it is by consensus that we got the 2010 Constitution. And therefore, the only way we can help this country is by ensuring that devolution grows. And it will not grow in the way we have seen. And therefore, as a Council of Governors, we continue to fight for this devolution space to ensure that the citizens of this nation do get the value of devolution. It is unfortunate for quite some time we have observed that there has been an attempt to claw back on devolution by going back on functions. Sometimes functions don't follow resources. And all of you are well aware that at the beginning of this financial year, about almost 20 billion was taken away from counties. This one denies the residents and the citizens in the counties of fundamental services that can only be availed if we have adequate resources.
As of today, county governments are owed Kenya shillings 74.98 billion in delayed disbursements as follows. Kenya shillings 7.19 billion for the month of March 2025 owed to 11 counties. Kenya shillings 34.87 billion for the month of April 2025 owed to all the 47 counties, and Kenya shillings 32.93 billion for the month of May 2025 to all the 47 counties. Additionally, over a week has passed since the signing of the County Government's Additional Allocations Act 2025, but funds are yet to be disbursed. This is a direct violation of the principle that resources must follow functions and undermines the constitutional right of county governments to receive adequate resources. The Council of Governors therefore urges an urgent summit meeting to discuss the implementation of the Gazette Notice and the immediate transfer of these resources to the counties.
There's a challenge when you buy a vehicle and donate it to the counties, and after donation you don't transfer the vehicle, it's still left as a GK. Insurance companies usually pay the owner. It becomes almost impossible to insure a vehicle that is under national government because it is not our vehicle. And there is nothing that the national government can be able to do in terms of using resources to procure for vehicles that the counties cannot do. And therefore we are urging the Ministry of Health, in all the other programs that they have, they feel that they need to ensure that counties are enabled in terms of mobility. Let them release resources so that the counties can be able to buy those vehicles. They can actually be able to issue a guideline if they feel that they want to control a bit of their donation in courts.
National government continues to disrespect the constitutional provisions with respect to implementation of policies that they want undertaken by the counties. In our financial framework, the framers of the Constitution thought of something called conditional grants. These UHCs were recruited during the time of COVID because there was need at that time to bolster human resource in health across the 47 counties. What should have been done is to give the resources to the counties so that the counties can recruit professionals that they needed at that time. The Council notes with concern that the Division of Revenue Bill 2025 proposes an equitable share allocation of Kenya shillings 405 billion, far below the Council's recommendation of Kenya shillings 536.88 billion. This figure does not account for the rising non-discretionary costs and the financial burden of newly delineated functions. A quick review of the supplementary 2 budget shows at least Kenya shillings 29.7 billion remains allocated to MDAs despite the Gazette Notice volume CXXVI of 16th of December 2024.
The 3.5 billion that the ministry wants to transfer to counties in payroll is basically what is paying the current salary of the UHC, which I already said is about a third of what they are entitled to. And therefore, should they be willing in very good heart to transfer that, just to borrow the words of my colleague who spoke earlier today, what they're doing to us is tantamount to giving the knife while holding the handle and giving the sharp side, while the knife is supposed to help us cut the meat. We are not going to accept it because that is a third of the money that is required to sustain those staff. The CS has issued a directive. He has purported that he's going to transfer the payroll for the UHC staff to the counties. And the position of the governors who are here today is that we will not be accepting a payroll that is not properly construed, because the UHC staff since 2020 have been on a job group that is very discriminative compared to their colleagues. They almost earn, I think, a third of the salary that the rest of the colleagues earn. That contract is coming to an end next year. We don't see the urgency that is there for the ministry to transfer a contract that is coming to an end in a year's time, when it has been on for the last 6 years, at the same discriminative job group that the UHC staff are out there about. And therefore our position is, let the ministry keep the payroll as long as they don't provide the prerequisite resources in the equitable share to be able to pay for this staff onward. It is a position that we have taken before at the summit. We have taken it again in our meetings, and our position is that we will accept that payroll when they are in the proper job group and the resources that are required to pay them their salaries going forward is availed in the equitable share. And that is a position in perpetuity. That is a position by the Council of Governors, and therefore the UHC staff out there should know that while the ministry has said they have been released to us, officially we have not received their payroll and will not be receiving it unless it has the money that is required.